Welcome to today's webinar. Today I have with me Rekha ma'am. Rekha ma'am will be giving a webinar on the impact of the COVID-19 lockdown on the way we operate in the offices or on the relationship between the employees and the employers. Over to you, Rekha ma'am.
When I was asked to talk about any topic, select a topic to speak, I chose this topic because this is what is going to impact all of us, every one of us who is working. Okay, so till now we are all used to working in a particular way. We had certain rules to follow, we had certain protocols, we had with great zeal designed processes, drawn up SOPs for how we work at our workplace. Post COVID, everything is going to change. So from now on, the world will talk about two eras or two phases, that is pre-COVID, post-COVID, right? So let us quickly start with what we are going to do at our workplace. So when I started thinking about how I will start my webinar, I decided to first start with the definition, the dictionary definition of employment, employer and employee. Very interestingly, in the dictionary, employment means the state of having paid work or the utilization of something. That is the dictionary meaning of employment. And an employer is a person or an organization that employs people. And an employee is a person employed for wages or salary, especially at a non-executive level. Now, when we talk about employers and employees, generally, the way we use it when we are conversing, we have different, understanding of it. We try to decipher it in different ways, and that's what the dictionary says for synonyms of employees. It says worker, member of a staff, member of the workforce, blue-collared work, white-collared worker, workman, laborer, artisan, hand-hired, etc. So now let us get into the employer-employee relationship in general. What are the kinds of work that you can think of? When I say employer-employee, it is a one-to-many, many-to-one kind of a relationship. You are related to your organization, to your boss, to whomever you want to call your employer. So here I've just listed down what are the different types of employer-employee association or the different stakeholders in an organization. I've said an entrepreneur, okay, a business conglomerate, a freelancer, a manager, a contract employee, a person on a third person contract, a shop owner, a small business owner, a government employee, a person working in a PSU, a person working for an enterprise, a person working for an institution, a proprietor. Now in all these kinds of working environments, there are going to be changes, right? So firstly, I would like all of you to understand that there are different kinds of working environments generally. As in, we have a manufacturing unit, we have a SME, we have a software in a firm, we have BPOs. So everywhere there are certain written rules for employment. Now when I put together all these scenarios, I decided to kind of broadly address 5 different aspects of work that will be impacted and that will have to change, and we will have to embrace this change. Okay, so first thing that I thought was interestingly going to change was communication. We were all talking about sitting together and talking in meetings, etc. Today webinars have become a way of life. Right now I am sitting and talking here. In another room there's a nephew of mine who's taking a class for his 10th standard. In another room there is my sister who's sitting and teaching somebody. In a third room there is my cousin who's addressing his employees. Now all of us are communicating with our respective stakeholders, if I can call it that, and each one are doing it in their own different way. So first thing we will have to understand is we will have to become more effective communicators, if I can say, not good communicators, effective communicators. So communication is going to be the key to managing insecurity and putting together an action plan. When I say this, what do I mean? There are lots of questions that people are walking around with. When I speak to people how it's going to be post lockdown once they go back to office, everybody have lots of questions, and these questions are hidden fears. They are worried about, will they go back to work? That is the first question a lot of people have. Will I still have my job? If I do, what will be the kind of job? Will I be working remotely? Will I be working on site? Will I be working at the factory? What is it? Then the second question is, once I go back to work, how will I handle all these things that we are talking about? Wearing masks, sanitizing your hands, adhering to all kinds of norms that are laid down by WHO, etc. So there are lots of questions that employees have. The first thing I feel is necessary would be the organizations, whoever is responsible, whether it is the HR person or an immediate boss, whoever, before people start hitting back to their regular work, people will have to be appraised of what the situation is, that have to be reassured firstly that their job is still on, they are still going to work, etc. So that is the first thing. Second thing is, you will have to get into a real time mode. I know when I was working in an organization, we would raise a ticket about printer not working or not having access to intranet or not being able to update my status, leave status on intranet. You raise a ticket, and there is this ticket will be forwarded to somebody, and that somebody will forward it to the concerned department. There somebody will address it, and then it will have to pass through the same cycle for it to come back to you, for it to get resolved. So end of the day, people will say, okay, I've closed all my tickets. Today it's not going to be like that. Post COVID, there is nothing like waiting for something to happen. There are no tickets that will be raised and closed end of the day kinds. You will have to address problems as soon as possible. Let us say there is an employee who's sitting at home. He's trying to log into a meeting, and it's very important for him to attend that particular meeting or be a part of that meeting. He's not having access. Suppose he sends a message saying that he's not able to get into the meeting. You can't wait for somebody to sit and resolve the issue after 4 hours or 5 hours. The meeting is over by then. So we are talking about a turnaround time which is going to be very quick. The support function will have to be very, very, very robust. That's when communication can get better. Another thing we'll have to talk about when we talk about communication is everything will have to get done. The cycle time will have to get shorter. Okay, so timely reporting. If there is, let us say, something that I had to deliver to a customer and for some reason I'm not able to do it, it cannot be assumed that somebody is going to follow up, and end of the day you can't tell no, today I had to deliver, I couldn't deliver this for so on reasons that I have. So you will have to do a timely reporting. Okay, so what I am saying is, today's world, communication will have to be seamless. That is as far as the employees are concerned. Now what about your customers? You live because of them. You are generating your money from them. So they are a very, very, very important aspect of your business model. So we'll have to keep talking to customers till you are able to actually service them, and even post the service, keep talking to them regularly and keep that link from snapping. So it's very, very important to hold on to your customers. This is the key to any business, whatever be the kind of business you're talking about, whether it is a very small service industry related work that you're doing for somebody, some kind of a service you're offering to somebody, or it is probably call center that you're operating for somebody, or you're manufacturing products. whatever be the thing, your customers are important to you. You are surviving only because of your customers. So always ensure that the connect that you have with them is on and a healthy connection is on. Somebody was telling me about 2 weeks ago, he said, करना क्या है? Business तो नहीं चल रहा है, तो बैठे हैं. I think this is the time you can reach out to your customers. Probably you even make new customers because of the rapport that you build with them. See, earlier we didn't have time to, I won't call it mollycoddling, but I will say you didn't have time to pamper your customers earlier. But today you have all the time in the world to do it. So you have to reach out to your customers, talk to them, find out what they want, how they expect things, and what you expect of them, right? So just use this time to strengthen your communication with them. A very, very, very important step, according to me. Next, the last but not the least that I would like to talk when I'm talking about communication is get into a consultative mode with your employees. I know that the working environment, when I talk about a corporate environment or even a small business where there is a head of an organization or a couple of heads of organization, whenever any decision is taken, there is a closed door meeting. There's a meeting that happens in a room. You decide what has to be done, and then that info is passed on to the next rung. So you go ahead, you decide on something, then go ahead and tell the employees, look, this is what we have decided. That will have to change, because according to me, the biggest, most important buzzword for the post-COVID working environment will be empathy. Each one will have to empathize the other. We are not supposed to sympathize anybody, but we are supposed to empathize them. When an employer, a boss, a manager is trying to implement something, try and understand what the employees are feeling. What is going through their mind? What is it that they feel? Because end of the day, when you give them tasks, they are the ones who are going to work on these tasks. So wearing a consultative hat is very, very, very important. Don't just go and, create rules, different new policies and just push it down on your people. Start talking to people before you really implement. I understand there could be a lot of chaos. Let us say there are 500 people in my organization. I can't go and take the opinion of all these 500 people, whether I do this, I don't do this, whether I do it this way, I don't do it this way. But at least where required, when required, whatever is a situation where it is feasible, viable, in these places, it's very important to go and consult your people below you, whether they are your direct reportees, employees, whoever they are. So communication is going to change. Like I said, people are going to be talking to each other but hardly seeing each other. But of course, yeah, I can still see you, you can still see me. This sort of a thing is there, but physically it's going to vanish. So I was working for an organization where, the first thing in the morning, people will come and check the calendars. So I have a meeting at 10, I have a meeting at 12, I have a meeting at 2:30, and at 2:30 we all sit in the meeting room, decide to when to meet again. That is going to change. So we are going to get into more of action, less of talking, and yes, we'll have to keep our communication channels open still. Now I will move on to the next aspect, which I thought was very important, the thing that we are going to talk about, health and hygiene. Gone are the days when, people will crib about taking showers, washing their hands, washing their legs, using sanitizers. I remember, a scene from a Hindi movie. I think this was Amir Khan. जाके ब्रश कर लो, चाय पीना है. शेर ने कभी मुंह धोया है, कभी कुल्ला किया है क्या, he says. So that was the attitude most people carried, and it was important to be presentable at all times. It was important to look clean. Today it's going to be different. We will have to actually think of becoming clean, and more so in the working space, because if anybody falls ill after coming to your workplace, then it is your responsibility, or you will have to shoulder the responsibility of the person falling sick because of having come into your organization. So we will have to start living with sanitizers, hand washes, sanitizing sprays. I'm a part of, I think, about 7 or 8 different WhatsApp groups. And initially, when the COVID thing happened, I used to see people talking about games to play, and people were talking about what they're doing in their free time, and everybody was talking about cookery, new recipes that they have cooked. Every day I would see a new picture. I saw the men folk talking about how they've become good in the culinary art, how they've started bartan dhona, jhadu poncha karna, all that. Suddenly, somewhere after the second stage of our lockdown, I saw the mood changing. People started exchanging work orders, bulletins, interesting articles, etc. They started talking about different kinds of things. And then slowly everybody started talking about COVID, the do's, the don'ts, and lots of things, It seems COVID-19 virus is this and you get it because of this. It seems COVID virus is not that and you can't do this. It seems COVID virus is not that, so you can do this. It seems if you do not touch any surface which is metallic, you will not catch the COVID. COVID virus life is only 2 hours on this, 5 hours on this, 8 hours on this kind of a surface, etc., etc., etc. And then I started seeing follow-up messages. There were a lot of people who were trying to refute, review and argue out these things and say, no, I read that this is not true. It is a myth that initially I read somewhere that if you are able to hold your breath for 20 seconds and if you don't find any pain in your chest, that means you're not COVID infected. Immediately I saw in another place that, it's a myth. There's nothing like that. So then I saw that slowly things changed even further. The WhatsApp groups started flashing news bulletins and, orders passed by WHO, then Ministry of Human Resource, the MHA's orders, etc., etc., etc. So we are going to start seeing how we will have to change things at our workplace. Firstly, very first thing is we will have to start thinking about all the measures that we will have to take at the workplace. Right? We will have to wipe surfaces and objects with a disinfectant that employees use regularly. Sanitize the lift operational buttons by regularly cleaning them. Employees should use hand sanitizers after using the lift. Do not touch your eyes, nose or face after touching any surface without washing or sanitizing your hands. Display posters promoting personal hygiene. I'm just reading out this because I made a list of everything that I thought was important to address. Okay. Advise to avoid close contact. That is, you'll have to maintain a 1 meter distance between employees or their family members also. Recommend using hand washes and hand sanitizers. Provide better respiratory hygiene to the employees by providing face masks or paper tissues. Checking employees' body temperature for low-grade fever using infrared radiation thermometer, etc. Now, this is going to get very, very, very challenging for employers. In the workplace, everybody's fever has to be checked. Now, who will be doing this? So, you probably, going to deploy somebody to do this. Now, if that somebody is a person who will start getting bored with the same thing that he has to do now, put that thermometer on everybody's face when every minute somebody is walking in, it is going to get boring for this person. This person may get slack and just say, chalo, fever hai kya? Nahi hai, chalo, andar chale jao. Now this is something that could happen. So try and see as much as possible how you can automate things, how you can use mechanical devices rather than having human intervention. Okay, so it's very, very important to get these things in place before you start calling your people to work. Okay, Now, let us go to the next point that I want to address. One, I was talking about sanitizers, etc. Now, a very interesting thing, which is probably of least priority, if I can say that, but then still you will have to address this also. What about your chai pani? Who's going to give you tea? Who's going to serve you? Your canteen was flooding with people. There are lots of things that you offered. There were vending machines. There were people who would give you chai, coffee, all that. Now, these people, it is very, very, very important for these people to be sanitized before they walk in. Of course, you're doing it for everybody, but more important for these people. And who's going to monitor whether these people are washing their hands every 2 minutes as it's required? And that is something you will have to be very careful about. Okay. Then comes the sanitization. When we talk about the hygiene, our toilets, bathrooms, people are touching the door handle. They will go in, they will come out, they will again touch the door handles. Now, we are not used to using a sanitizer every 2 seconds or washing our hands. Some people have that habit, but some people don't. Now, how cool is this? It's going to get very dangerous. And I happened to see the video of a person who was COVID-19 infected, probably the first in Bangalore. He's a person I seem to forget his name. His name is some Venkatraman or something, if I'm right. So this person was talking about how he was affected by the pandemic. So his guess was he was coming from somewhere outside India, and in between, I think Frankfurt was where he said he had stopped. He said those finger scanners, he used that. And then he said he had used the restroom there. So he said the doctors have told him that he could have caught the virus at one of those 2 points. Now, it's very important to be very careful. Firstly, I read this interesting message somewhere, It said, follow the women, do not touch the men. When you say do not touch the men, it says avoid touching your mouth, eyes, nose. So follow the women means wash your hands with soap and water, obey social distancing, mask to be used properly, eat more alkaline foods, never ignore the above 4 lines. Very interesting. So it so happens that, the more somebody tells you not to touch your, nose, eyes, whatever, you tend to feel an itch in the nose, on the eyes, which never has happened probably in the last 30-40 days, right? So this is something that you will have to consciously start developing. And at the workplace, be very conscious about this is something that you must have heard at least 50 times in a day, be conscious about people who sneeze, who cough, etc., etc., etc. Right? So there are a lot of things that are guidelines laid down by WHO, etc. So see that you follow all this when you go to your organization. Now, very interestingly, somebody was asking me, we have outsourced 50 of our staff and they work at the client place. So what about these people? Now, be very careful again when you outsource your employees. Talk to them, find out what are the norms followed at the client place and whether they are adhering to all these rules that are laid down by the WHO or any governing body. Right? Now, next thing is whenever there is fever, I see people being shy talking about it. Every fever is not COVID fever. Please be sure that we are living with hundreds of different kinds of viruses in this world, and not all are COVID-19, right? So first thing is, the moment you feel that you are seeing some symptoms, go to the right doctor or testing center, whatever, and see that you are ruling out the possibility of having caught the COVID-19 virus. So there was a neighbor of mine. She was, I think this was in the beginning of March, if I'm right, or mid-March. She caught a cold and she was coughing incessantly. Every time she coughed, her husband and mother would close all the windows and doors. They were worried about what the neighbors would think. Where they're going to, it is a stigma that is attached to it, how they're going to stigmatize this and say that, she has caught a COVID virus, etc., etc. So this is something all of us will have to get a little more open about, as in I'm not saying you flaunt your fever, flaunt your cough, or any other ailment that you have, but wherever required, keep your employer informed and preempt in case you've caught the virus, preempt giving it on to somebody else. Very interestingly, now we are going to, redefine our so-called great policies. See, I was a person who have devised HR policies for different companies, and very proudly we feel that we have adhered to all the laws of the land, and we have taken care of everything that has to be addressed. Now, when you talk about your leave, I think Jayadev here had asked this question: how do you handle sick leave? So, first thing, if an employee comes to work and at the workplace you realize that he has a fever, that is, when you're screening itself, I'm talking about, let us say he has a fever and you just stop him from entering the office, you ask him to go back home, apply for a sick leave, number one. Second thing, let us say he has already come into the organization and at the workplace, somebody notices that this person has been coughing or sneezing time and again. Again, please be assured, not all sneezes are because of COVID-19. This last 1 month, I know a lot of people who have done a lot of cleaning in their houses. Some people are allergic to dust. So I personally am very allergic to dust. So if, I clean my premises, the whole day I'm sneezing. I sneeze about 100 times a day. So it doesn't mean I have the COVID virus, but at the same time, I can't go and sit in my office and keep sneezing through the day. So anytime you notice any of your employees doing this, you will have to send them back home, mark their leave as sick leave. Now, leave, when you're talking about, how are you going to address this leave? Everybody has, broken down their total leave, annual leave into PL or EL, whatever you want to call it, your earned leave or your privileged leave. Then you have a sick leave. Then these are the different kinds of nomenclature that you use. Today, sick leave is something that will have to be redone. So there are some guidelines I read in a couple of forums where there is an advice saying that you have actually, compartmentalized your leave, right? So if a person is sick because of the COVID virus, and if he's compelled to stay in a hospital or stay in isolation, whatever, that time will be treated as leave, as sick leave. And if you want to set off this sick leave against any other kind of a leave that somebody has already accrued into his account, you can go ahead and do it. Number one. Number two, if a person suffering from COVID-19 returns to office only after he will have to return to office only after completely getting cured with a certificate saying that he has been cured of the virus. Then again, you can say that the organization reserves the right to recover this time from the final paycheck of employees whose tenure is over, who resign, or whose termination happens before they rebuild the accrued sick leave. This is something which is very interestingly to be followed, because when I say leave, everybody has certain amount of leave. Now he has crossed that threshold, everything, and suddenly let us say the employee is leaving the organization for whatever the reasons. Now this leave, you are at will to probably deduct their salary for this leave, right? Next, if there is a parent or a child at home who has to be vaccinated for the COVID virus, an employee can take leave, and this can be treated as sick leave. A very interesting thing that I heard in one of the discussions or panel discussions that I attended, there were 3 people who were sitting and talking in this particular panel discussion, and one of them interestingly was from a manufacturing background. Now when I talk about manufacturing, if somebody has to be on the shop floor to sit and do his work, there is no way he'll be sitting at home and working, right? So he has to get back to work. Now I heard from this person saying that every employee is given a form that he'll have to fill up before coming back to work. He will have to, answer a small questionnaire where it says, what is your temperature, and did you have a cold in the recent past, and did you have a sore throat, etc., etc., etc. He said that, this man was the head of HR of a very big manufacturing concern in Chennai. He said that employees tend to fib, tend to lie. Even if they are fine, they say that, I'm sick. Now, I really don't know who is telling the truth and who is not. Now, here, employers will have to devise a way how to address this. As in, suppose somebody is reporting sick, you will have to devise means and measures to ascertain this person is really sick. So it is very important to understand. I think this is what Jayadev was asking some time ago. So if somebody is not sick and he's feigning illness, now how do you address this? This is going to be a very big challenge for all employers, because somewhere, we've all become very slack. I won't use the word slack, but somewhere we have resigned to the fact that, I don't have to go back to work for some time. So you're used to your routine. You're far away from the running to office at 7 or 8, whatever, train pakadna, bus pakadna, etc., etc. Now, employers will have to devise ways of how to track their employees' health. So you will have to devise means of how you'll get it checked. So probably if somebody is ill or if somebody has visited a doctor, he will have to send proof to say that he has visited a doctor. Some consultation, he would have paid a consultation fee for which he has a receipt, or he has gone to a dispensary where there is a test conducted or whatever. Now this is going to be a very, very challenging thing for employers in future. Then you will have to track your sick employees. This is again another important thing. Now let us say somebody has reported that he is fallen sick and he's having fever or whatever. So you will have to try and find out where he stands today, whether he's all right, he can come back to work, how much better he is, all that. Now, social distancing, washing your hands, I don't think I'll have to talk about it, because every day we are seeing this on TV and any other social media that we are visiting every day. I come to the very important point next. We are going to talk about money and monetary issues. Mula, that is what all of us work for, right? All of us are concerned, worried, speculative about what will happen to my bonus that I'm supposed to get. There are a lot of people, see, when this COVID onset happened between February and March, was the time when a lot of people had to have their annual appraisals. A lot of people had already conducted their appraisals, were waiting to roll out the results. Some people had already rolled out the results, but the monetary benefits were still not given to the employees. Some people had not conducted their appraisals at all. So there are different companies which were in different stages as far as the appraisals were concerned. Now, this is where I am going to talk about empathy ever so much. As an employee, I will say that, look, I have slogged the whole of last year, and I have performed so well. I've been rated, I've got a rating of say 4 on 4 or 5 on 5, whichever is the rating system, and I deserve this, I deserve that. Yes, you deserve it, but then try to look at it from the employer perspective. Now, how many employers can really manage the show with what happened in the last 3 months with the lockdown? Let us talk about very small concerns. Let us say there's an organization which employs about 10 people. Now this concern, whether it is a proprietorship firm, a partnership firm, an LLC, whatever it is, let us say there are 10 people who are working, and they cater to a particular kind of customer base, whether it's a product they are selling or a service that they are selling. They have not seen business for the last 3 months, as in they've not got money coming in. So quite a few people have not been able to even pay salaries. Now, there was a very small example of a person I met a couple of days ago. This person has a car showroom. So his sales were nil. But then he has to pay his rent. He has to pay for whatever services that he has opted for annually. Rent, yeah, there are a lot of people who have this argument where they're saying, you can have a deferred payment or whatever. But then he has to pay them, right? End of the day, he has to pay. Now, it's going to get very tough and challenging for this man to pay if he doesn't have reserves. Then comes, the salaries that he will have to pay. I know that, every person I meet from different sectors, whether it is the pharma industry or a doctor who is working for somebody or an engineer or a software engineer and any other IT professional, a person working for a very small recruitment firm, every person I met, the first thing I was asking them is, have you been paid your salaries? And you'll be surprised to hear that there were different kinds of models that I saw. Somebody had paid salaries in advance for a year. I mean, my brother told me this about, I think, Jitendra's daughter. She runs a production house. She opted to pay for her employees for the entire year. Now she has cash reserves, so she did that. Then there was somebody who said, I got my March salary, but April, I'm not sure. There was somebody who said, I got full salary in March, but April I'm getting only half a salary. And there was somebody who said, I have not been paid at all for the last 2 months. There is somebody else who said that, I've been paid my March salary, but it has been set off against the 30 days that I was at home has been set off against the PL that I've accrued. Now, let us not even get into the legality of this. Let us start looking at the feasibility, the viability here. How possible is it for a person to pay when he or she is not getting money? Now, this is where I said it is very important to empathize. Now, all of us tend to be selfish. I too am. If somebody has to give me 10 rupees, I feel that I deserve that 10 rupees because I've earned that or I need to get that. Now, whether the other person is able to give that is of least concern to me, right? So, we will have to start becoming more empathetic in the sense that, we will have to start understanding what is it that the employer is going through. And this is going to thicken your bond with your employee or employer. Your employees are here to stay if you empathize with them at these times. So is your employer bent upon retaining you if you are trying to put up with a few problems, a few changes that will have to be done in this kind of a situation. There are some companies who have published annual rewards, big time bonuses, etc., which have been stalled. And I know there are a lot of organizations where the top management has been asked to take a 10% cut. And believe me, there are people who have done that willingly. Because they're saying that, when organizations are not paying anybody, at least my organization is paying me 90% of what I should get, or my organization is paying me 70% of what I should get. This is something that is going to strengthen the bond between you and the organization. The organization or the employer is going to be very happy that you didn't throw tantrums. At the same time, you will have to be happy that the employer is still retaining you. With great difficulty, believe me, there are a lot of people who are retaining the employees with great difficulty, and wherever it is not possible, there are layoffs happening. Of course, there are, government rules which says that you can't cut your salary, you can't demand your rent, you will have to, pay your employees, you can't terminate everybody. Yes, we will have to live by the laws, but then I see as a person, I am basically a postgraduate in business law. Whenever I talk to people, I have this feeling that even before following a particular law or even before trying to adhere to a principle or follow a policy, the first thing anybody is going to think about is how to break this rule or how to break this law. Everybody wants to know how you can get away with not following this law. So believe me, there are ways that employers will decide or start finding ways as to how they can lay off people if they really want to lay off. And there are people who are still trying to hold on and say, no, I'm not going to send anybody home, but probably I can't pay my full salary, or I can't pay my bonus this month, or I won't be able to give you, your variable pay this year. This is where it's very important for all of us to empathize and say, this is something that has not happened earlier. So let us cooperate. A collaborative approach is what is expected of people now. You will have to tend to become more and more collaborative and say, and more adjusting and say, okay, I will try and adjust for this time, so let us see what will happen. Believe me, everybody is talking about an economic slowdown, lot of concerns, closing, a lot of factories shutting down, etc. So naturally there will be people without salaries, people without jobs. So be happy that you still hold on to your job. Be happy that you still have a salary coming, even if it is deferred or in part. Try and understand that this is not here to stay, but now this is the need of the hour. And all your so-called rules, people will tend to break because they're not able to stick to them. See, rules, policies, procedures are all formulated by the people for the people. The moment you see that adherence is going to get tough, people will tend to break them. Okay. Next, I come to the aspect of employee engagement. Now, when I say employee engagement, everybody can quickly visualize, at least the IT folks, it's very famous. Your bring your child to the office, or your rangoli competitions, cooking competitions, and games, outdoor events, and going to a picnic, going on a short trip, campfires, parties, booze parties. All this has become a thing of the past in just 2 months. We are all going to live in a different world now. At the office itself, there was a place where I was working. Every day there would be a celebration. It would be somebody's birthday, or somebody's just baked a cake at home and they carry it, or it will be a team member's birthday and somebody orders a cake to surprise them, and the cake cutting happens. Everybody sit together, each one feed the other, and there are people who are licking out the cream, all that. A very fun kind of an atmosphere. That is not something that is going to happen, at least in the next 6 months. Forget about partying in the office. There are a lot of people who have closed their cafeterias in the office, who have started telling employees that, you can eat at your desk. Please carry your own food. We will not be serving lunch. Tea, coffee with great difficulty. Some organizations are. Some can't afford to do even that. It's not because of the expense that is incurred for these things, but it's only because of the rules, the hygiene issues that has to be followed. And another important thing is, whenever you talk about employee engagement, it is very important for any manager, any team head, any head of the organization to keep talking to their employees, boosting their morale, talking to them, addressing them and saying, look, we are all here to stay. These are difficult times and we'll come out of it. You are with us, we are with you. You are still a part of the organization, and I am still a part of your life. There is also an importance from the employer's side to go back to the employees, reassure them about how there is promise for the future, what is to come. Today I may not be able to give you this, but yes, this is what we are planning and this is what we are doing. I was amazed when I spoke to a couple of people. They were people who have very quickly thought of new business ideas to complement and supplement their income or the money flow. There are people who are kind of bringing in, augmenting new pieces of work, complementing and supplementing their service offerings to look for new ways to bring in money, income, whatever. So this is something that has to be shared with all your employees, number 2. And then the work-life balance. This is very important. I have a cousin of mine who has been working from home from the first lockdown. And she is somebody who works from morning 9 to night 9, because she has So does my brother. Now, they have teams reporting from different time zones. Somebody's working from Singapore, somebody's in Europe, somebody's in the US. Now, if they have to address these team members throughout the day, they are sitting in front of their laptops, trying to take on meetings, trying to address their people on a remote call, etc. So it's very important for us to understand that they'll have to be a work-life balance. Particularly for the ladies, there is no housemaid. So there is no crèche where you can leave your children. There is nobody to take care of your children because you can't call over your parents or your in-laws to take care of your kids. Now, there is this kid who is bawling, and there is the cooker whistle that you can hear, and there's somebody who's attending a meeting. These are things that we will have to start living with for some time at least, till we are resigned to the fact, or till we understand and assimilate the fact that, it's a way of life and all of us are going to have these sounds. We are not living in soundproof houses. So I was attending a webinar last week where I heard a peddler continuously, peddling something for nearly 10 minutes. This is something that none of us can help. We are not living in soundproof houses, right? So we will have to think of different ways how we can keep our employees engaged. And very interesting, I saw in another ad that I saw, or a small TikTok video that I saw, where this fellow said fun and games used to be only a rangoli once a year, which we used to get off with. But now the HR thinks it's important for me to play Antakshari, and every time my wife, I tell her I'm working, and every time she's passing, I'm sitting and singing a song. She thinks I'm goofing around. So this is something we'll have to get more realistic about, what kinds of things we think about or what we devise for the employee engagement. Next is we'll have to think about accountability and visibility. So you tell your employees what the organization is up to, what is it that you have planned for the next 6 months. Now everybody says COVID is here to stay for another 6 months, 1 year, God knows how long. So what is it that as an organization you have done to protect the interests of your people, safeguard your business, get new business? So this is something, again, employers will have to keep their employees informed about. The last but not the least, we will have to talk about the logistics and the modalities. Very, very important is how to follow social distancing. There was this man who says there are 60 buses that ply every day to bring people, that was the pre-COVID I'm talking about, to bring people, the workforce, to their office. Now 60 buses will have to suddenly become 120 or 140 because no two people can sit next to each other in a bus, right? Now what is the cost that the company is going to incur? Is it viable? Is it possible? Is it feasible? So is it necessary to call all your workforce? So there are a lot of companies who are saying they will operate with only 1/3 their workforce on site. So the support staff. Now at least these people will have to go to office every day. So the lifts, people are saying that not more than 2 or 3 people should go in a lift each time. So how feasible is that? How are you going to manage this? If you say that, in one floor there are 900 people working and this is probably the 10th floor, if 2 people will have to go up the lift, God save, 450 times the lift will have to go up in a day. Just to go up, first to report to work, if people will have to go to work, right? The traveling, the commuting, it's advised, everybody says, it's advised that you don't carpool, you don't use public transport, don't take the public buses or the metros or your Ubers, Olas, etc. But how is it possible? Everybody cannot drive down to their work. So you will have to start thinking about how to address this. Then remote working. Like I said already, we have discussed this. People will have to start getting used to sitting at home and working in front of their laptops with their headphones on, whatever. Working hours. This is very important. Like I mentioned earlier also, your HR guidelines say that even if you're working from home, you will have to work for 9 hours. Now these 9 hours, how you're going to manage these 9 hours are very important. How the company is going to track these 9 hours is even more important. Now there are people who will fill log sheets, time sheets, etc. So these things will have to get monitored more diligently. People will have to look at it with more interest, probably look for more detailing there. Okay, so again, when you start thinking of devising new rules, you will have to really get into a consultative mode, decide what is mutually possible, viable, and go ahead with this kind of a thing.
Right. So if anyone has any questions for Rekha ma'am, please put them in the chat or put them in the Q&A section so that she can answer them.
Actually, there was somebody who's already asked a couple of questions. One I've already addressed. There was a person called Jayadev. He has said how to manage a fall sick leave of the employees. Some employees may take advantage during some work emergency. This is something I've already spoken about during the thing. This is going to get very critical, because the moment somebody says he's sick, as a preventive measure you should ask him to work from home. The moment you say work from home, there are a lot of people who are trying to take advantage of it, is what I have heard. So you will have to devise ways of trying to keep track of such employees. Try to ask them to produce a doctor's certificate to prove they are ill, or if they have visited a doctor, they would have paid that consultation fee, that receipt they will have to show, or whatever. And if it's an organization where there are very few people who are like this, it is, I don't know how feasible it is, but then there is one person whom I spoke to who said they have a department called the internal customer cell or something. So there is somebody who from the team who visits them also to really find out, not to spy on the employee, but then probably to find out if they need any help. Okay. Then there is a Sushil Kumar who has said, as most organizations have given the corporate employees work from home, and it is observed that 80% work can be done work from home, what is the impact the organization after COVID or after the lockdown? Like I said, see, once you ask a person to work from home, it is your onus to see that you provide them the right paraphernalia or the right gadgets to do this. I know people who are going left, right, center, procuring dongles, who are arranging for internet connections for their employees, who are hiring laptops, PCs for their employees to sit and work from home, etc. So this is going to be a thing that you will have to think about. While there is a flip side to it, there are a lot of people who are saying, I'm very happy that this thing happened, because I've realized that my biggest hole in the budget is my rent. And if all my employees can still have managed rather, sitting at home and working for 2 months, I would rather give up this office and take up a small, place somewhere. So this is something that I have heard from many people. Next, there is another person, Sushil Kumar, who has said, if employees have COVID and have been hospitalized for 15 days, how do these leave be calculated or not? This will have to be treated again as sick leave, like I said. Now, if the person's entire sick leave has been eaten upon, then you will have to set it off against any other kind of leave that the person has.
Yes, probably, ma'am. I think the questions have all been answered. Well, thank you
Okay.
all the attendees for coming in today and listening to Rekha ma'am. And thank you, Rekha ma'am, for making time for us for Dheya.
Thank you, Suruchi.